She'll cover everything that matters before you head out the door. Melissa in the Morning on WICC 600 AM and 107.3 FM. Southern Connecticut's news and information leader.
Here's a question for you this morning. What's to blame for women not being able to afford medical care, even if they have health insurance? This comes after we learned some information from researchers at the NYU School of Global Public Health, examining data from the National Health Interview Survey, which is an annual CDC survey. It found that both men and women who have most health care services, they're less affordable now compared to what they were in the early 2000s. But women in particular found all types of health services to be less affordable compared to men. Why is that? Joining us this morning to give us some perspective, Paul Seegert is here. He's a managing partner at PCS Advisors, a health benefits consulting firm with 35 partner offices across the U.S. Good morning, Paul. Welcome back to the show. How are you?
I'm great. Good morning.
So first, Paul, before we tackle the difference between women and men and the affordability, why in general could you tell us that it's so much more expensive to get any kind of health insurance coverage now than it was even 20 years ago? What's gone on to make that such a big difference?
Yeah, we've changed. We pushed a lot of costs to consumers especially in this post-Affordable Care Act era of healthcare. To distribute healthcare and maintain costs, we pushed up deductibles, co-pays, max out-of-pockets to such a number that our consumers face greater out-of-pocket costs, greater out-of-pocket risk. You can have as high as the $90, $100 out-of-pocket mix in this year, and each year it goes up. Not that all people face that, but people do. And even if it's not that extreme and that high, it's still significant when you compare it against what our peer countries would pay in terms of consumers. So we face more out-of-pocket costs. As a result, we've put 100 million Americans have medical debt, and most of them have insurance.
Yeah, that's the startling part there. Paul, I apologize. I can hear you, but I don't know if our listeners can hear you very clearly. Are we either on speaker? Sorry about that. I just want to make sure we can hear you.
Is that better?
That is better. Yes. Thank you so much. Okay. Appreciate that. Yeah. So, Paul, it sounds like in the last 20 years, we've basically seen upticks in a lot of the prices that go into health insurance coverage. But I think the most startling thing you just said there is that you have millions of Americans who have health insurance, but they cannot afford their medical bills.
Right. We've got 100 million Americans with medical debt. And at any given time, depending on where subsidies are and various fluctuations in the rules, we don't generally have more than 10% of our population that doesn't have insurance. So most of those 100 million Americans have insurance. And to me, that startling is a good word for that. I mean, we can't look at that and say we're doing a great job. We've got 100 million Americans who are having to make payments on medical expenses, and it has a lot to do with the way that we've evolved these plan designs.
Well, I was going to say, I think it makes people almost say, why do I even have it? Why even have health insurance? Yeah.
A lot of them feel functionally uninsured. And then you have the creation of HSA style plans, those health savings account style plans. I'm not for or against them. I just think consumers, we're also not great consumers of healthcare. We're not given good information to consume. But we just don't spend a lot of time on it. You know, I've admittedly, even in our own home, we've spent more time this year planning a vacation for spring break than we did thinking about what healthcare plan to choose for the new year. And that works fine if you're in good health, but there are people that will pick those plans that have the lowest premium, not realizing monthly, out of their paycheck, you could say. And then I find out later, oh my gosh, it's lower because I'm subject to covering all of my own costs up to a certain number. And it could be thousands of dollars.
Yeah, it's a big reason that you should definitely consult with an agent if you have a health insurance agent or somebody you trust, and not to miss those deadlines, not to ignore them, like open enrollments, things like that. Really have those conversations, but unfortunately, it doesn't always happen. We're talking to Paul Seegert this morning, a managing partner for PCS Advisors, talking about unaffordable health insurance. So, what's interesting about this article that I was reading, Paul, is the fact that women, I guess, have a harder time finding affordable plans than men do. Why?
Well, you have the reality that women from 19 to 44 tend to use more health care. They're the ones having the children. So during this childbearing stretch of time, women are going to use more health care. And not all of it falls under it's covered at 100% list of things. They're twice as likely to have mental health needs. They're more likely to have multiple chronic conditions. And you have health factors that are just part of, differences between males and females. And then you have demographic issues. They're more likely to be in poverty. They're more likely to be single heads of household who are in poverty. And we also have just to throw out a laundry list of contributing factors, we also have a lack of primary care in this country. Mm-hmm. So they're far more likely to report that they don't have a primary care doctor. So they're having to rely on clinics or urgent care centers or that kind of thing. And that's not the same as having someone that you interact with regularly who knows your situation. Primary care done right is really hard to find anymore. It's a dying thing, and we've got to save it. But that advisor, that trusted advisor, they're more likely to report that they do not have that person.
So then, Paul, what is the answer there? Because it sounds like you could probably, you probably will get the same sort of health care, maybe that's less affordable as men, but the problem is you have more medical debt. Like, it sounds like you're going to have more medical debt because women have more needs, essentially. They go through, historically more than men do. So what could we do?
Yeah. Well, there have been some proposals. Of course, poverty is a factor. And although just because you can afford it doesn't mean you're excited about the fact that you're spending more.
Sure.
Poverty is certainly an issue. And some have made proposals that we might want to extend Medicaid coverage beyond, say, just depending on times and variation in rules and states and stuff. It can be that you only have that coverage 60 days after you have a child, or for a limited period of time that maybe doesn't capture all of the related care that you might need for that. So I think that's something that would be worth looking at. Then are we doing the best job in that area, or can we make some adjustments there?
Well, Paul, I really appreciate your insight and even just sharing with us sort of a snapshot of what America is looking at, and the fact that, yes, we're all struggling to pay for our health insurance, and some of us are in medical debt right now, but women actually have a harder time with this than men do. I was not aware of that, but you make a lot of sense, and I appreciate getting your perspective this morning. Thank you so much.
Thanks for having me.
Absolutely. You too. Again, Paul Seegert this morning, who is a managing partner at PCS Advisors, a health benefits consulting firm with 35 partner offices across our nation.